Imagine not recognizing the faces of those you love most, losing the ability to think clearly, or even manage simple tasks on your own. Dementia isn't just a health condition. It's a heartbreaking reality that affects millions of people, stealing cherished memories, disrupting daily routines, and leaving families heartbroken. But what if I told you that some of the ordinary medications we take every day could silently increase our risk of dementia? Shocking, right? But here's the good news. Dementia isn't an inevitable part of aging. The latest research reveals powerful ways to reduce your risk, and one of the most surprising discoveries is the link between certain widely used medications and dementia. In this video, we'll uncover 8 common medications scientifically tied to dementia risk. And here's the twist. The last one on the list is the most alarming, and it might surprise you. Stick with me until the end to learn how you can safeguard your brain health and take control of your future. 1. Hormonal contraceptives. Hormonal contraceptives, particularly combined ones containing estrogen and progesterone, are widely used not only for preventing pregnancy, but also for managing conditions like menstrual irregularities and acne. While these medications are effective and convenient, emerging research raises concerns about their potential long-term effects on cognitive health. Sex hormones, such as estrogen and progesterone, play a critical role in brain health, influencing memory, neuroprotection, and overall cognitive function. Altering their natural levels through prolonged use of hormonal contraceptives may have unintended consequences. Studies have suggested a possible link between long-term use of these contraceptives and an increased risk of cognitive decline, including dementia. For instance, research published in the Journal of Women's Health tracked women who used hormonal contraceptives over extended periods and found a subtle but notable decline in cognitive function. Additionally, other studies shows that women using hormonal contraceptives report higher rates of depression, decreased sexual functioning, and greater interest in short-term sexual relationships compared to those who are naturally cycling. A comprehensive review of 32 studies revealed that depression nearly doubles the risk of developing dementia. If you're using hormonal contraceptives, it's essential to weigh the benefits and risks with your doctor. Non-hormonal alternatives like copper IUDs, barrier methods, or natural family planning methods may offer safer options. 2. Pain medications. Opioid painkillers like morphine and oxycodone are commonly prescribed to manage severe pain, particularly after surgeries or in patients with chronic illnesses. These medications work by targeting the central nervous system, binding to specific receptors in the brain and spinal cord to provide effective pain relief. However, beyond their well-known risk of dependence, prolonged opioid use has been linked to troubling effects on cognitive health, including a heightened risk of developing dementia. Research published in the American Journal of Geriatric Psychiatry found that patients with chronic pain who regularly used opioids faced a significantly higher risk of dementia and exhibited worse brain health compared to those relying on non-opioid pain relievers. Another study in the Annals of Internal Medicine tracked individuals with long-term opioid use and discovered a strong association between extended opioid consumption and an increased likelihood of dementia. These findings highlight the need for doctors to carefully assess the risks and benefits of prescribing opioids, especially for elderly patients. You might think, I don't use opioids, just NSAIDs like diclofenac or ibuprofen. Surely those are safer. Unfortunately, the news isn't much better. Studies have shown that even NSAIDs can significantly increase the risk of dementia in older adults, particularly with heavy or prolonged use. If this information is helpful, please like and subscribe to the channel. 3. Proton pump inhibitors. Proton pump inhibitors, such as omeprazole and esomeprazole, are commonly prescribed to treat gastric issues like acid reflux and peptic ulcers. These medications work by reducing stomach acid production, offering relief from symptoms and preventing damage to the esophagus and stomach lining. However, emerging research has raised concerns about the long-term effects of using proton pump inhibitors on cognitive health. Studies have found that prolonged use of proton pump inhibitors can interfere with the absorption of essential nutrients, such as vitamin B12 and magnesium, both vital for maintaining brain function. Vitamin B12 is crucial for healthy nerve cells and the synthesis of DNA and RNA. Impaired absorption of vitamin B12 due to proton pump inhibitors use can lead to neurological symptoms, including memory loss and cognitive decline. Magnesium supports neurotransmitter function and protects the brain from damage. Low magnesium levels have been linked to a higher risk of neurodegenerative diseases. A 2023 study published in the Journal of the American Academy of Neurology highlighted a significant association between popular proton pump inhibitors and an increased risk of dementia. The findings suggest that these medications, while effective for stomach issues, should be used cautiously, particularly by elderly patients who may already be at a higher risk of cognitive decline. 4. H2 receptor blockers. H2 receptor blockers and proton pump inhibitors are both designed to reduce stomach acid, but they work through different mechanisms. H2 receptor blockers, such as ranitidine and famotidine, target histamine H2 receptors to lower acid production. They typically provide relief within an hour, lasting 6 to 12 hours. In contrast, proton pump inhibitors like omeprazole and esomeprazole block the proton pump, offering more potent and prolonged acid suppression. However, proton pump inhibitors often take a full day to become effective, with results lasting up to 24 hours. H2 receptor blockers are generally recommended for milder, short-term use, while proton pump inhibitors are preferred for managing severe or chronic conditions. However, there's a potential downside to consider. A study published in the Journal of the American Geriatric Society tracked over 1,000 elderly people and discovered a link between regular use of H2 receptor blockers and an increased risk of dementia. This finding highlights the importance of monitoring long-term use, particularly in older adults. If you're taking H2 receptor blockers, it's crucial to discuss these risks with your doctor to determine the safest treatment plan for your needs. 5. Antiepileptic. Antiepileptic drugs, AEDs, are essential for managing seizures in individuals with epilepsy. However, emerging research indicates a potential link between long-term AED use and an increased risk of developing dementia. The mechanisms driving this association are complex, involving both direct and indirect effects on brain health. One significant way AEDs work is by modulating neurotransmitter systems in the brain. These drugs often target neurotransmitters like gamma-aminobutyric acid and glutamate to reduce neuronal excitability and prevent seizures. While this mechanism is highly effective for controlling epilepsy, prolonged alterations in these neurotransmitter systems may adversely impact cognitive functions over time. Numerous studies have investigated this connection, providing compelling evidence. For example, research conducted by the University of Eastern Finland and the German Center for Neurodegenerative Diseases highlights that long-term use of AEDs is associated with an increased risk of Alzheimer's disease and other forms of dementia. 6. Anti-Parkinson's drugs. Anti-Parkinson's drugs are among the medications most strongly associated with an increased risk of dementia. Recent studies reveal that the prolonged use of commonly prescribed drugs for bladder conditions, Parkinson's disease, and depression may significantly elevate the likelihood of developing dementia later in life. The connection between these drugs and cognitive decline stems from a combination of complex mechanisms. These include the direct pharmacological effects of the medications and the progression of the underlying diseases they are designed to treat. A central mechanism underlying this link is dopamine dysregulation. Anti-Parkinson's medications such as levodopa, dopamine agonists, and MAOB inhibitors aim to alleviate motor symptoms by increasing dopamine levels or mimicking dopamine activity in the brain. However, while these drugs improve movement-related symptoms, their chronic impact on dopamine balance can have intricate effects on cognitive functions. The brain's dopaminergic system plays a crucial role in cognitive processes like attention, learning, and executive function. Dysregulation of this system, particularly in key regions such as the prefrontal cortex, can impair these cognitive abilities and contribute to cognitive decline over time. Another contributing factor is the potential for neurotoxicity and oxidative stress. Anti-Parkinson's drugs that elevate dopamine levels can inadvertently lead to oxidative stress. During dopamine metabolism, reactive oxygen species are generated, which can damage neurons through oxidative mechanisms. Prolonged oxidative stress can progressively harm neuronal structures, increasing the risk of cognitive deterioration. 7. Antipsychotic drugs. Antipsychotic medications used to treat conditions like schizophrenia, bipolar disorder, and severe depression have been linked to an increased risk of dementia. These drugs work by modifying the effects of neurotransmitters in the brain, effectively managing psychotic symptoms such as hallucinations and delusions. However, prolonged use has been associated with significant side effects. A study published in the British Medical Journal observed elderly patients taking antipsychotics and found a heightened risk of dementia, with extended use further accelerating cognitive deterioration. Given these findings, careful medical supervision is critical for individuals prescribed antipsychotics. Regular monitoring helps identify side effects early, allowing for timely adjustments to dosages or transitions to alternative that may pose a lower risk to cognitive health. 8. Anticholinergic antidepressants. Anticholinergic antidepressants belong to a class of medications strongly associated with an elevated risk of dementia. These drugs are often prescribed to manage allergies, urinary incontinence, cold symptoms, and even Parkinson's disease. Common examples include diphenhydramine and oxybutynin. Their mechanism of action involves blocking acetylcholine, a neurotransmitter essential for memory and muscle function. While anticholinergics are effective, their long-term use has been linked to detrimental effects on cognitive health. Acetylcholine plays a critical role in learning and memory, and prolonged suppression of this neurotransmitter can impair cognitive function. Research indicates that consistent use of these medications, particularly among older adults, can negatively impact brain health. A significant study conducted by the University of Washington followed over 3,400 adults for more than 7 years. The findings revealed that regular use of anticholinergic medications was associated with a 54% increased risk of dementia, especially at higher doses and with prolonged use. If you take anticholinergic medications regularly, it is crucial to consult your healthcare provider to discuss potential risks and explore safer alternatives. Many conditions treated with anticholinergics have less harmful options available. For example, nasal corticosteroids are an effective alternative for managing allergies without posing the same cognitive risks. Your health matters, so always consult your doctor before starting or stopping any medication. It's crucial to discuss the potential risks and benefits and explore safer alternatives to safeguard both your cognitive and overall well-being. Thank you for watching. If you found this video helpful, don't forget to like, subscribe to the channel, and share it with anyone who could benefit from it. See you in the next video.